Welcome to the Crossroad Talks, where science meets the unknown. I am the Witch Doctor, and today we will be discussing a fascinating topic that sits at the intersection of science and spiritualities, energy healing, and evidence-based medicine. Now, I have an MD with a master's degree in counseling psychology, but I'm also deeply interested in the metaphysical aspect of healing. This topic isn't just academic to me, but it's something I have explored personally. The question at hand is not whether energy healing or modern medicine is better, but rather whether these two systems can coexist. And if they can coexist, what does that mean for our understanding of health? Let's dive into this with precision, depth, and a commitment to intellectual honesty. Let's define our terms before proceeding. Energy healing is a broad category of practices that claim to manipulate the body energy fields to promote healing. It includes modalities like Reiki, crystal healing, crystal therapy, and the energy cleansings. Now, these practices are often dismissed as pseudoscience, and let's be honest that a dismissal isn't entirely unjustified. Many energy healings modalities lack of evidence, but, and this is a big but, that doesn't mean the experiences of practitioners and patients are without value. Take Reiki, for example. Developed in Japan in the early 20th century, Reiki involved the practitioner placing their hands just above or lightly on the patient's body, channeling what is described as universal life energy. A meta-analysis published in Pain Management Nursing in 2018 revealed Reiki's effects on pain, anxiety, and fatigue. It found moderate benefits, particularly in cancer patients and those who are recovering from surgery. But here's the catch. The studies had small sample size, and methodological issues. This is a recurring theme in energy healing research, promising results clouded by inconsistent study design. And then there's crystal healing. The idea here is that certain stones emit vibration that influence the body's energy. Scientifically, this doesn't make any sense. A 2001 study in perceptual and motor skills conclude that the effects of crystals are likely placebo-driven. However, the psychological impacts of engaging in rituals involving crystal, like stress relief or mindfulness, is well documented. So, while the crystals themselves may not have measurable energy fields, the rituals surrounding them may still hold value. Now, let's turn our attention to evidence-based medicine, or EBM. This is the backbone of modern healthcare. It relies on three pillars: clinical expertise, patient values, and the best available evidence. Through this framework, treatments are rigorously tested through methods like randomized control trial, systematic reviews, and meta-analysis. Take vaccine. For instance, smallpox has been eradicated and diseases like polio are nearly extinct in many parts of the world. These are triumphs of evidence-based medicine. But here's where things get complicated. EBM focuses heavily on measurable outcomes. Objective data point like blood pressure reading or tumor size. This focus, why necessary? often overlooks the subjective aspect of healing. How does a treatment make a patient feel? Does it address their emotional and spiritual needs? These questions are harder to quantify but no less important. Let's drill down into scientific research on healing, energy healing. Reiki, as I mentioned earlier, shows promise in reducing stress and improving quality of life. A 2020 review of global advances in health and medicine found significant reductions in anxiety among hospitalized patients receiving Reiki. But, and this is important, the study also pointed out a lack of standardization among Reiki practitioners. Without consistent training and protocols, it's difficult to measure effectiveness accurately. Biofield therapies, a category that includes Reiki and therapeutic touch, have also been studied. A systematic review in BMC Complementary Medicine and Therapies in 2020 reported mixed results. Some studies show reduced stress and improved mental health well-being, while others found no significant effects. What this tells us is that there's potential here, but we are not yet at a point where energy healing can be considered a reliable standalone treatment. Energy healing is not without its challenges or its risk. One of the biggest issues is the lack of standardization. Practices like Reiki and crystal healing can be vary widely between practitioners, which complicates the research and clinical application. How do you measure the efficacy of something that isn't consistently applying? Another concern is the potential of harm. A 2023 report in the New England Journal of Medicine highlighted cases that where patients delay or refuse conventional treatment in favor of alternative therapies, often with devastating results. Energy healing should never replace evidence-based medical care. Instead, it should be seen as complementary, a way to address aspects of health that conventional medicine might overlook. Now, let's talk about the placebo effects, often dismissed as just placebo. This phenomenon is actually a testament of the power of the human mind. A 2015 study, the Journal of Pain, found that placebo treatment could reduce pain up to 30%, activating the brain's natural opioid system. In the context of energy healing, this means that belief in the practice could trigger real physiological responses. Does this diminish the value of energy healing? Not necessarily. If a practice helps someone feel better, whether through belief, ritual, or a combination of factors, it had values. The placebo effects remind us that the mind and the body are deeply interconnected. So, what's the path forward? Integration. Institutions like the Mayo Clinic and Cleveland Clinic are already incorporating complementary medicine, therapies like Reiki into their integrative medical programs. This approach combines the rigor of evidence-based medicines with the holistic focus of alternative practices. It's not just about replacing one with another, it's about finding the balance. To make this integration meaningful, we need more high-quality research. Study must be better designed with larger sample sizes and standardized protocols. We also need education for both healthcare provider and the public to ensure that people understand the strengths and limitations of both approaches. Energy healing and evidence-based medicine may seem like opposing forces, but they both aim to achieve the same goal: improving health and well-being. By embracing the strengths of each and addressing their limitations, we can create a more holistic healthcare system, one that treats not just the body, but the mind and spirit as well. Thank you for joining me today. If this discussion resonated with you, share it with someone who might find it interesting. And remember, at the crossroad of science and spirituality, we often find the most profound insights. I am the Witch Doctor, and this is the Crossroad Talk. Remember, when it's time to cross the road, I know you look both ways. Until next time.